My name is Rachel, and I'm going to be performing my musculoskeletal exam on my patient today. So first I'm going to inspect all of the joints and everything today for any redness, swelling, tenderness, crepitus, any deformities, anything like that to start. So nodules and for symmetry as well. So first I'm going to assess the hands, okay? So first I'm going to check for the capillary refill on each hand. So I'm going to assess each fingernail here and on each hand. And there's good color, good warmth, redness, no abnormalities that I can see. So that's a 2+ capillary refill, so that's perfect. Okay, good. Next, I'm going to assess your radial pulses bilaterally as well. I'm just going to assess for pulses that are present. Good, and then assess the other one as well. Good. And, you know, overall color, warmth, redness, no edema, and symmetry on each hand is good. So next we'll do the finger range of motion test here. So we'll have my patient stick out a finger, just kind of like this. So we'll have flexion is this kind of motion here, and then extension, flexion, extension, hyperextension. Good. And then we'll do the adduction and abduction test. So adduction is this, an abduction. So abduction, abduction, and adduction, okay? And we'll do that with each hand. So the adduction and abduction, abduction, adduction, good. Okay, next we'll test your grip strength. So squeeze my hands as hard as you can. Perfect, that's 5 out of 5 strength, I would say is very strong. We'll look at her wrists next. Check for any redness, swelling, tenderness, crepitus, symmetry, anything like that. Everything looks pretty normal. We'll have the wrist range of motion test. We'll have you do some wrist flexion. So I'll have you put out your hand like this. So this is flexion, extension, hyperextension. Good. We'll do the ulnar deviation. So we'll kind of rotate the wrist to the right towards the pinky. That's the ulnar deviation. Radial deviation is the opposite way, kind of turning it towards the thumb. Okay, good. Rotation, wrist rotation is this sort of movement here, which will have you. Good, perfect. Okay, good. Next, we'll assess the elbows. Same thing. We'll look for tenderness, swelling, crepitus, any sort of abnormalities. They both look pretty normal. Next, we'll do the range of motion on the elbows. So elbow flexion, so kind of flex your arm up. That's flexion, extension. Good. Hyperextension would be kind of when the elbow goes kind of this goes past and kind of goes down, and you know it wouldn't be 180 degrees. You would kind of go past that right there. But this looks normal. This looks fine. We'll test your bicep strength. So kind of just